Gestational and chronic hypertension. Well, that's mean a blood pressure equal to or more than 140/90, and the gestational age cut-off point will be 20 weeks. So I mean, if the blood pressure 140/90 or more, and the gestational age below 20 weeks, that's called chronic hypertension. But if the blood pressure 140/90 or more, and the gestational age more than 20 weeks, that's called gestational hypertension. The next step in case of gestational hypertension is to check for preeclampsia. So the next step is to check for proteinuria. If proteinuria negative, then it is just gestational hypertension, and just treat the hypertension by using either methyl dopa or labetalol in the pregnancy. But in case of positive proteinuria, I mean it's more than 5 gram per 24 hour, that's called preeclampsia. And the next step in case of preeclampsia is to first check for signs of severe preeclampsia, and the second step is to check for HELLP syndromes, which I will talk about this soon. So suppose it's negative, I mean there is no signs of severe preeclampsia, and at the same time there is no criteria for HELLP syndromes, so it's just preeclampsia. So the treatment will be first control blood pressure by using either methyl dopa or labetalol. The second step will be prevent convulsion by using magnesium sulfate. And the treatment of choice and the best treatment for preeclampsia will be delivery. So the treatment either delivery by using normal vaginal delivery or cesarean section according to patient condition. And if the patient near the term, so the treatment of choice and the best treatment for it will be delivery. And if the gestational age or if the woman far from term, then just expectant management by using controlled blood pressure medication and at the same time using magnesium sulfate to prevent convulsion. Okay? Now let's talk about signs of severe preeclampsia. What I mean by severe preeclampsia signs? Well, that's include first, headache and blurred vision. The second one will be epigastric pain or right upper quadrant abdominal pain. The third one will be vaginal bleeding, and the final one, which is the most important one between them, is hyperreflexia. So if a patient with a preeclampsia and has one or multiple of these symptoms or signs, that's called severe preeclampsia. And the treatment of choice for severe preeclampsia is immediate delivery. Please, immediate delivery. Either normal vaginal delivery or cesarean section. Just delivery. This is the treatment of choice in case of severe preeclampsia. You cannot wait, okay? HELLP syndrome. HELLP syndrome means first, elevated liver enzymes, and the second criteria for it will be decreased platelet count. If a patient with a preeclampsia and has elevated liver enzyme and decrease in platelet count, that's mean HELLP syndrome. And the treatment of choice in case of HELLP syndrome is immediate delivery, same as severe preeclampsia. So please, any patient has preeclampsia with signs of severe preeclampsia or HELLP syndromes or both, the treatment will be immediate delivery, either normal or cesarean section. I just want immediate delivery as soon as possible, okay? Now I talk about preeclampsia. Now I will talk about eclampsia. What is eclampsia mean? Eclampsia mean patient suffer from preeclampsia and he develop convulsion. So any patient with preeclampsia and developed convulsion, that's mean eclampsia. It's not preeclampsia anymore, okay? The treatment for eclampsia will be if the patient in convulsion, so the next step will be ABC, airway, breathing and circulation, as any convulsion, and also give supplemental oxygen. The second step, if still convulsion, then give diazepam. And the third step is to prevent recurrent convulsion attack by giving magnesium sulfate, which is a muscle relaxant. But the best treatment over all these treatment for eclampsia is immediate delivery by using caesarean section, not normal vaginal delivery. Caesarean section only for eclampsia. Okay, it's the definitive treatment. It's the definitive and the best treatment at all. Okay, now let's talk about magnesium sulfate toxicity. Well, magnesium sulfate is a muscle relaxant drug, and it's usually given as an infusion to any patient who would suffer from preeclampsia to prevent any seizure attack, and also to any patient with eclampsia. Now, what is the sign of toxicity? The first and the most important sign of magnesium sulfate toxicity is loss of deep tendon reflex. It's very important. Any patient who is taking magnesium sulfate, and when you come and check him, and you will see there is no or decrease in deep tendon reflex, that's directly mean magnesium sulfate toxicity. Another very serious sign is respiratory depression and coma due to relaxation of respiratory muscle. So the treatment for magnesium sulfate toxicity will be: first step, stop the infusion immediately, and the second step will be give calcium carbonate IV to protect the heart. So that's all what you need to know about chronic hypertension and gestational hypertension, including preeclampsia and eclampsia and magnesium sulfate toxicity. For full course, you can contact us through amcqbook@gmail.com. Thanks and goodbye.